the workload, it was hands down, internship, residency was nothing compared to being a stay-at-home mom. So
wow,
being a mom is no joke. That's definitely by far the hardest job in the world. And any of my doctor colleagues can challenge me on that. And I don't think any of them would disagree with that statement.
Sharon is here, longtime Philly friend. Over a decade now. You were at my wedding, which is so funny. It's like Gianna and I were attached at the hip when I was in Philly. And then you and me and Sana were out all the time in Philly.
No, I don't know how I didn't meet you.
We never crossed paths.
And she was like, oh yeah, she was at my wedding. Did you meet her there? I was like, Kacie, there were 8,000 people at your wedding. No, I didn't meet her.
300. We think we cured COVID with that wedding. It was kind of a super spreader event. We think we single-handedly beat Omicron with that gathering, but who am I?
That was amazing.
Know?
I don't think anyone got sick after that.
She did.
Oh,
I did, but I've had COVID. I think I just had COVID again, like a week ago. So I think I've had COVID 4 times, 2 of which were during my pregnancy with Jack. So I don't know. And I'm super asymptomatic, and that's something we can talk to you about. I have O positive blood. So there are just people have been grasping at straws to explain COVID for now going on 4 years.
Yeah.
So I think that it's like one of those things where I've heard that over and over, like, oh, if you have O positive blood or O blood, you don't have symptoms as badly as those AB people. I don't know what it is, but there's like something. Is there anything to that?
Yeah, no. That's a fantastic rumor that went around, but no, there's nothing to that.
Dang Tic Tac.
But the good thing is with COVID, with the Omicron variant, many otherwise healthy individuals were asymptomatic, completely asymptomatic. So that's the good news with Omicron. So nothing to do with A positive or O negative.
Same question about bug bites. Is it have to do with your blood type? Because I swear,
the mosquitoes bite you because you have sweet blood.
Daughter and I will get ripped up, and my husband doesn't get one thing.
Yeah, so that actually is nothing to do with blood type. It has to do with hormones. So testosterone is a deterrent, and that's why also kids, boys and girls, prepubescent, so before the testosterone goes crazy, are more susceptible to bug bites, and so are women. Men, not as bad. So lucky them.
That's an unfair thing.
Gianna also does shave her legs, so it is path of least resistance to the point of entry.
Oh my gosh, is this like, you know how like when you're hunting and they say you have to like take like deer urine and like hunters rub it on themselves to attract the deer? Can I take testosterone and rub it all over my body to make sure that I don't get bug bites? Because it's like not okay.
Well, I told you, my corner of Instagram, everyone's slapping beef tallow all over themselves. So maybe that would work. Maybe you could just use that as a moisturizer. It's anti-aging.
I definitely would not recommend smearing testosterone because it might defeat the purpose of shaving the legs then.
Gianna like comes on next week with a mustache.
Listen,
and chops down her face.
Oh yeah, no, there are some days I would most likely be willing to have like full hairy legs if it meant that I wasn't getting any bug bites. So I don't know.
Well, we're also Italian, so that is like every other day. Wait, I want to go back to, because Gianna, Dr. Zagoni talked about this when we had her on in October, and she talked about how people who got COVID, aged backward, like aged in reverse, like some kind of regenerative because something or other.
Fasting. She said when you're very sick, you're not eating as much, and the fasting was actually promoting a reverse in biological aging. Or
Are you seeing
aging.
that? So I'd have to go over like the science behind that in my head with fasting and reversal of aging. So if you separate the COVID out and you say, okay, fasting reverses aging, I don't know if that's true, or I'm sure there were studies done on that, but I would go with no.
Maybe like cell turnover or something.
So the only thing that kind of makes sense with that is, in general, as Americans, our diets are terrible. What we put in our bodies is terrible. I mean, just thinking about what I had today, um, and some of the stuff that I even feed my kids, I'm like, oh my, like I cringe as I'm giving
Well,
it
you
to
have
them.
2 preteen boys, so you just have to like they
Yeah.
run and you just
Yeah.
have to like hit moving targets with burritos. Like
Oh my God,
it's not your
they're
fault.
endless trash cans. It's amazing. I love it. I'm like, okay, is it second dinner or third dinner tonight? Um,
Yes.
but so definitely giving your metabolism a break from processing foods seems to improve health overall, and that improves aging. Also, when you think about um, reduced carb load, so again with fasting, giving your metabolism a break, and the bio the gut biodome that we have, it's anything that reduces inflammation, again, reverses aging potentially, but nothing to do with COVID, I don't think. I think that's I would disagree with that as a whole statement, but having better diet and exercise and in general a better diet, and maybe partial fasting, uh, may be good for reversing aging or keeping a better overall health. I think that's a safe statement. But I know when I
Wait,
had COVID the first
Sharon, I'm gonna
time.
have you switch. Can I have you switch to the other Wi-Fi? Sorry, you keep like
Sure.
it keeps like popping in and out. So I think the other
Glitching?
one might be better.
Okay. Hold on one sec.
Okay.
Okay. How's this? Better, worse? Is it
Yeah,
glitching? I
what do you
think this
think,
is
G? What does it
worse.
sound like?
It looks about the same, but
Which one do you usually use for your hits?
I think I usually use the other one.
Okay, then yeah, let's try that one. That's
Okay.
fine.
Okay.
All right, G, what do you want to jump into next? You want to go off this document that we have?
yeah.
Okay.
All right. Now I'm on the other one. Let me see if there's anything open that I can close. No, there's nothing here. Yeah.
No, it's perfect. It's good now. It's great now.
Okay. Okay. I could tell you when I had
I want
COVID,
to
I
go
was
off
eating
of
everything because I lost my sense of smell, and I was wondering if you separate taste and smell, if you still have the same appetite. So I was literally eating everything. I was trying to figure out as like a scientist, well, if I eat ice cream, will it taste just as good if I can't smell it? And I was like, oh yeah, it does taste just as good. If I eat pizza, will it taste just as good if I can't smell it? Oh yeah, it still tastes just as good. So I was eating a ton.
Were there
Oh my
any
God.
foods that you were like, no, this is not gonna work when you don't have a
No,
taste of smell
I literally ate
or sense of smell?
everything, and everything tasted exactly the same without smell. Oh, that's just me.
Huh.
I only lost my sense of smell 1 out of 4 times, and I was pregnant that time.
Hmm.
What about you, G?
I don't. First of all, knock on all of the wood around, but I haven't had COVID from what I.
Have you not had COVID, or have you not tickled your brain with a Q-tip?
I've tickled
Yeah.
my brain with a Q-tip quite a few times, but I've never had it. Put it this way: I've never had a positive test for COVID, and I've never had, or like, there's never been any other like a time that I've said, "Oh, I might have it," and just haven't tested. Anytime I thought I had it, I've tested, and knock on wood, hadn't. But I also have a very terrible sense of smell. Like I always said, if you were to put like 5 to 7 like aromas in front of me, I would only really pick up like 2 of them. I don't
Like, so when you go for a pedicure and or like a spa treatment, and they're like, here, which oil, complimentary oil? It's like, okay, thanks for the
yeah.
complimentary oil. Like, all right.
Sometimes
Like, you can't pick one?
those types of things I can. It's mostly like if they're because I feel like they're at like higher levels or like very concentrated. But if it's like a candle or a cologne or like something, I can't.
Candles are the new secondhand smoke.
Are they?
No. Are you
Bruh.
kidding? Are people saying that?
Candles are literally the new secondhand smoke. I did not think that we were going to get to Casey's crunch of the week this early in the episode, but also fragrances are not good. Anything you buy that says fragrance in the ingredients, stop buying it. And your perfumes and cologne, if you want to keep using it, spray it. Same like rules as pregnancy, like spray it on your clothing, not on your skin.
Yes. Well, so that was something that Dr. Stoll and I were talking about. We actually were at the same hospital at the same time that we were working at together. Or no, we almost overlapped by a year. But one of the studies that they were doing there at Thomas Jefferson in Philadelphia was about like roll-on or like spray perfumes, and how if you like, women always do it on your neck. That's like what you're told, or your wrists or whatever,
like right at your lymph nodes, right?
Right. And how it could be like actually going into your thyroid and your lymph nodes and creating certain cancers and diseases and stuff. Anyway, a lot that we want to get to today with Dr. Stoll, and first of which is your experience with motherhood. You have two beautiful boys who are garbage cans in terms of their eating, as you say, which
very
I
handsome, very
love.
brilliant garbage
I love
cans.
it.
Yes.
So I think it's important for the audience to know that like you not only have the information that you're sharing with us today is on the clinical and professional level, but also from a personal experience from you being a mom. So tell us briefly about your kids and what your experience as a mom has been like.
Sure. Experience as a mom has been like no other from day one. And this is going back 12 plus years because my oldest is 12. I actually had him while I was a fourth year medical student. And I started.
I was just trying to do the math, and I was like, "You were in the thick of it when you had this child." Yeah.
Oh yeah. Yeah. And when I started my internship, honestly, working as an intern didn't come close to being at home with this baby. I mean, the workload, it was hands down. Internship residency was nothing compared to being a stay-at-home mom. So honestly, and this is something that I tell all my patients, I tell everybody, being a mom is no joke. That's definitely by far the hardest job in the world. And any of my doctor colleagues can challenge me on that. And I don't think any of them would disagree with that statement.
So is Meredith Grey a liar?
Yeah. Wow.
No, so she
I feel like
did
that
her
needs to be
residency.
blasted on billboards across America so people understand.
Yeah. No, but when Meredith had kids, she wasn't a resident. So
true. She had that cushy gig.
Yeah.
She was saying, "I'm not seeing any more patients. Sorry, practice is full." No, I'm just kidding. I also don't think people fully understand. I know they don't fully understand how difficult it is to become a doctor.
Yeah, it's extremely, extremely, extremely difficult. I mean, but again, you take out being a doctor, even if you're working 80 hours a week and you're barely sleeping or you're pulling 36-hour shifts in the hospital, there are moments where you get a break. And there are days that you have off that you could sleep. Of course, it took me no time to realize that it was easier for me to just stay in the hospital when I wanted to sleep than rather come home and be woken up every 5 minutes by a screaming baby. So I frequently did that. I would just stay in the hospital. But that's the main difference between being a mom and being a doctor, even a resident where you're working 80 hours a week, where as a mom, you can't even go to the bathroom without your kid. You can't take a shower without your kid.
What kind of mom guilt did you feel?
I was just going to ask the same question. Yeah.
What kind of like crippling mom guilt did you feel?
Honestly,
like how did you do it? Like how did you get yourself through that?
Yeah. I kept telling myself, I do not feel guilty because if I was home right now with my kid, I'm not a good parent. I'm sleep deprived. I'm cranky. I'm anxious. I'm depressed. I'm stressed. And I have no patience. And I'd rather someone that has slept well the night before and has a lot more patience than I do take care of this baby right now, because I would not I would not be good at it at this time. But I also, one of the things that I also mentioned, and I talk about this, but with my first kid, I had a lot of postpartum depression, a lot,
Mm.
and that definitely affected my work and my home life, and everything that you read in medical school and residency about postpartum depression wasn't true for me. I had a very supporting, loving family, husband. At the time, I lived a few blocks from my parents. My mom helped me whenever I needed it. I had 24-hour, 6 day a week live-in help. So it had
So
nothing
did
to
you
do with
psych yourself out of it for a while? Like, did you tell yourself, like, Sharon, we're good. Like, we are checking all the boxes. We've got the help. Baby's good. Like, was
no.
there like a psychological battle you had with yourself? Because I know I would be like, well, you're selfish. Why did you have this babe? Like, like go into that like self-talk that you
Or
had.
women often do that. You have nothing to be
Yeah.
upset about right now. You have
Yeah.
look at all the help you have. You have
Yes.
nothing
Yes.
to make you feel this way.
No, I didn't think about any of that. And that's one of the things with
Oh, you're
postpartum
so
depression.
strong.
No, I didn't do it because I didn't even realize that it was postpartum depression. I just thought,
Mm.
clearly there's something wrong with me. I'm missing that mom gene where I don't want to be home with my baby.
Oh.
And I just
Where you
thought,
felt like
okay,
I'm
this is me.
detached.
Yeah, completely detached. And I mean, I worried about him every second of every day. I thought for sure my baby nurse is going to kidnap him. And I feel like every mother eventually goes through
I
that.
still think that.
That feeling,
I
right,
think
right.
someone's
Like
gonna
someone's
climb in the window at night.
Uh-huh.
yeah. And like, but it, I literally, I just thought I was losing my mind. There was no rhyme or reason for how I felt. And I just thought I was so busy with work that I didn't even have a second to think. It was
Yeah.
just taking care of patients until I came home and had to take care of my baby. And then I felt like I wasn't doing a good job, definitely not taking care of my baby. And thank God I had other people around me, and I kept thinking that well, at least someone else can give him love because I feel like I'm so removed from him. And I feel guilty about that now for sure, because I had a very different experience with my second. And it really took me until my second kid to realize how bad my postpartum depression was with my first.
I was just going to ask that. Like, when did it click for you? Like, oh, wait, this is me. And then really what pulled you out of it? Or do you think it was just time and experience?
It was time. It really was just time, and removal from that period, just perspective of, and it was strange because all of my friends that had kids were telling me, "Oh my God, don't you feel so attached? Don't you feel like you would do anything for this baby? Don't you just love him to death and feel like, he's a part of you?" And in my mind, I rationalized it. I went through IVF, and I thought, and I kept saying, "He's not my kid. This is not my kid. They mixed up the embryo. I have someone else's embryo.
Oh
It's
my
someone else's
gosh.
child."
Wow.
My husband was like, "Let's do a DNA test." I'm like, "No, because then we're going to prove that he's not ours.
Oh,
Then what are we going to do? We're going to be stuck with someone else's baby, and we're going to know for a fact that he's not ours." I mean, it just went so far
Wow.
beyond normal. And again,
catastrophizing. Yeah.
I didn't meet any of the criteria for somebody to be concerned about this. And of course, I kept all my thoughts to myself because I realized how crazy I sounded, you know. But also being in the medical community, I know things can happen. As rare as they are, as rare as it is for an embryo to be implanted in the wrong parent, I kept thinking, but it happens. And maybe that's me. And maybe this kid's not mine. And I kind of use that
So
as an excuse to detach.
what's in short a message you would send to a mom listening right now who's like, wait, that's me. Like, I am feeling these same things. Like, what do you want to tell her?
Get help. Get help. Talk to a professional about this. The feelings are there. You can't and you shouldn't rationalize yourself out of it. And it's not doing a service to your child, and it's definitely not doing a service to you if you feel this way. And And there are trained professionals to deal exactly with this, with postpartum depression.
I love that you can't rationalize yourself out of it.
Yeah.
That's like something that we all are like, no, I got this.
Yeah.
Like I see you. We'll be fine. Yeah. It's like, no.
Yeah.
Right.
So
You can't.
a lot of that obviously is there's so much that's going on in the brain, as you just shared, in terms of like, oh my God, is this even my child? Or am I okay? Or can I handle this? Can I not? Blah, blah, blah. But we talk so much about mom brain too, about like, oh, I don't remember anything from certain periods of the postpartum, or the forgetfulness is rampant, and your brain is kind of just focused, hyper focused, if you will, on certain things. How much of what we call mom brain is actual like physiological effects of the body of birth and pregnancy? Are there like scientific things that we can point to that you've seen in your studies?
And if
Oh my
there
gosh.
aren't, lie.
No,
Sharon,
there are.
lie.
There are. Mom brain is real. Just like, I hate comparing it to this, but it's the closest comparison. But chemo brain. And a lot of people kind of understand chemo brain, like if you're going through chemotherapy and your body's being blasted with
Exhausted.
hormone, you know, there's a certain amount of inflammation that happens in our brains, and we can't focus. And there is this cloud and this haze that we suffer with. And actually, with COVID, we're realizing it more and more. And in the community, in the medical community, we're starting to attribute a lot of what people are telling us as, you're not crazy. This is something that's happening. But with COVID, a lot of people experience something that women everywhere have been experiencing since the beginning
Brain
of time,
fog.
mom brain, right? I mean,
Yeah.
my God, it basically, it's from the second there's an embryo developing inside of you until at least 6 months postpartum, where everything is kind of hazy and blurry. Sleep is off. You're so tired you can't function. I mean, I would fall asleep standing up.
Yeah.
I fell asleep taking a test when I was pregnant. That's not normal. You don't fall asleep taking a standardized test. But it's the same thing that people on chemotherapy suffer from. That but it's definitely real. There's no doubt about it.
And it's crazy that there's nothing that can really be done to help that. I think, I was sharing with Dr. Stoll that I had the hyperemesis gravidarum, which I've talked about on this podcast. And the sickness was awful, the vomiting, the nausea, all of that. But sometimes almost what I felt was worse was the debilitating fatigue, because there was no like anything that I could take to try to help that. And
especially
I remember
when you had Sienna. Like when you were pregnant with Sienna, it's one thing, but then having a full child.
Oh yeah, that having
means
a full
you is
toddler
another layer.
When I'm pregnant and I physically can't open my eyes. I mean, so many days that I just laid there and was like, I just need to lay here with my eyes closed. Like, that's how much pain my body is in. And every single doctor I met with was just like, well, we're sorry, like that's pregnancy. And that's just insane.
Yeah.
Yeah. The one thing that I would say to moms listening that have exactly that have that mom brain, that debilitating fatigue, and they're running after another child, cut yourself slack. I mean, that's the best thing to do, because we all know that giving a kid screen time or sitting a kid in front of something or locking them in like one of those baby cages, I hate using that term. What's a better term?
We call it the Thunderdome here.
The Thunderdome.
Thunderdome. Putting them in the Thunderdome and throwing in every single possible toy. Don't worry about overstimulating them, or even if, God forbid, you have to give them a screen, do whatever you can to help yourself. I think that should be a big takeaway from all of this, that you can go to the doctor, you can listen to recommendations. We have lots and lots of years of experience, but unfortunately, when you're living in it, it's very different than reading about it. And And honestly, as mothers, we want to do what's best for our kids, and we want to be the best mom possible. But
Yeah.
sometimes being the best mom possible means taking care of you first, because
Yeah.
if you
Question
are not taking
about
care
that.
of you, your kid is not. Your kid's going to
Right.
be the one that suffers.
It's a domino effect onto everybody else in your family.
Gee, you've done naturopathic or attempted naturopathic remedies when you were sick, right? Like, didn't you do acupuncture?
No, it's funny because you said that in the other episode too, and I was
Okay,
like, "Did
then
I?"
you
I
know
don't think I
what?
did.
Then you know what happened? The what you call it, timelines, we shifted, and that was another reality that happened that I'm remembering for some reason. And
Your
we're on a
mom
different
brain makes you
we're in a
think
different
that I had
no,
acupuncture.
we shifted realms. I have a question for the
Oh, but by
neurologist
the
on the
way, I
podcast.
love acupuncture. I'm just going to put it out
Okay,
there.
Okay.
I've
Love
never done
acupuncture.
it. I've never done it before, but there is such a shift, and I'm sure you're seeing it, of like the naturopathic, the Eastern medicine,
Functional
the ancient,
medicines,
the functional medicine. So you were talking about with Mom Brain when Gianna brought this up. You're not crazy. People are saying you're not crazy. So where do these alternative medicines come in? Frequencies, meditation, manifesting. Like, how important is that, and how legit is that?
Mm.
Oh, that is a great
I mean, you
question,
can't
and that I
like
could
like
spend
Gianna isn't like head in the toilet like you're not sick. You're feeling you're going to run a marathon with the baby on your back. Like no, like there's a point where like your physical body is whatever. At least I think. Maybe I'm limited. I'll turn the mic over to you.
No, there. So this is something that actually I studied a lot in medical school and after medical school. I'm a DO, I'm an osteopathic physician, and one of the reasons I am a DO is because I love connecting the two, Western and Eastern medicine, but more importantly, the body. You have to look at the body as a whole and not as different organ systems, which is something that unfortunately
Yes.
Western medicine is very, very good at doing. It's we're going to separate the
Hmm.
brain, we're going to separate the heart, we're only going to think about this one system, and and that's something that you can't do. Everything's connected, so that's where functional medicine comes in, and that's also where a holistic approach and a more naturopathic approach comes in. So something that I talk a lot about with my patients. So I'm a neuroimmunologist, meaning I'm a specialist in the brain and the spinal cord, but also in the immune function of that. And when you're looking at the immune function of the brain and the spinal cord, that's where the rest of the body comes in. Because again, you can think about the immune system, but it's the immune system's effect on everything else. So anything so one of my theories is that with certain illnesses like COVID, and there are other viruses also, it revs up the immune system, and that's what wreaks havoc on the brain and causes a lot of these the fog, the haze, the clouding, difficulty getting words out, difficulty staying awake in the middle of the day, even though you slept 12
Taste,
hours the night
smell.
before. Yeah. And that I think that anything that reduces that inflammation, and that can be something as simple as having better control over your blood pressure and your heart rate, can affect. And that's where meditation, acupuncture, um, uh, things like that come in and have a very, very, very strong connection with. So there are numerous studies that look at acupuncture, and overall the studies are not positive. It's not, oh, acupuncture definitely cures this or solves this. That's not what it shows. What it does show, which is interesting, is that real acupuncture and fake acupuncture are both effective at treating a lot of issues, right? So that's where, you can have somebody that says, oh, well, I'm skilled and I'm more skilled than that person that studied in America because I studied in this Chinese institution and my acupuncture is more real. Okay, that's great. Fantastic. But what it shows is that acupuncture, no matter what you're doing it for, if it improves your basically your fight or flight response, that the heart's racing, blood pressure is going up, if it improves that and helps regulate that, I think that's the goal. And that's also the goal with meditation and yoga and anything else in that realm.
So you talked about how these viruses can basically like attack the system, and then like the inflammation goes up and everything goes up, and that's what we're seeing some of these responses. Would it be fair to say that sometimes pregnancy can ignite that in the body too?
Yeah, 100%. And it's interesting you say that. So pregnancy actually, a lot of people with autoimmune diseases realize that when they're pregnant, their autoimmune diseases calm down. And some people are like, oh,
Oh.
that's interesting. Like I have MS, I have rheumatoid arthritis, I have psoriasis, and they're all better with pregnancy. And some people are like, I wonder why that is. It's because the baby is basically a virus. So think about that, okay? Here you have a foreign object that your immune system is like, do I attack it? Do I leave it? What do I do? I feel like I shouldn't kill this pathogen that's growing inside of me,
And taking all my nutrients.
Yeah.
taking all my nutrients. Right, but that's basically what it is. The baby is a virus, and that's why your immune system, people with autoimmune diseases, their immune system attacks them. So now the immune system
Oh, it's
is calmed down.
distracted. Look over
Exactly,
here.
exactly.
Yeah.
Exactly. So it's just kind of hanging back and waiting, and watching and seeing what's going to happen, but it's less. It doesn't attack you as much. So a lot of people with autoimmune diseases that otherwise, when they're not pregnant, they're tired and they have brain fog and they have difficulty walking. Those symptoms actually improve. But for other people, it worsens.
So, okay, now we have a reason for it. Now we know why the body is reacting the way that it does sometimes. We
Right.
hear a
And now
lot about.
we're going to have headlines. Dr. Stoll believes pregnancy is a virus. Every mother is hosting a.
Oh, I can't wait for the rehearsal dinner for one of your sons. You'll be like, this little garbage can virus, he's really good at soccer, but let me tell you what.
Yep.
So we hear often, or at least we've started to hear about 7 years, that you should give yourself 7 years to really come back, which sounds crazy. And my son is 9 months old, and I have to remind myself that sometimes.
Buckle up, Buttercup.
Oh my God. I mean, he's 9 months old, and I have to tell myself that like at least weekly, like, bro, he's 9 months old. You just had a baby less than a year ago. Like, stop this negative self-talk. Stop the pressure you're putting on yourself. So if we're hearing 7 years, or even just like 3 to 5 years, basically whatever the timeline is, because every woman is different, but giving yourself some time. What are your thoughts on how long it takes for a woman to come back, and how much of that is focused like cognitively that it takes for women to come back?
Oh my God. You don't even want to know my thoughts. I can tell you my husband has this theory. So as much as here's the next part. This is going to get me in a lot of trouble. Basically, I'll keep it PC. Imagine all of your mental energy is now going into raising a child and making sure that child stays alive.
Imagine.
Correct.
Okay, I'm imagining what that might be like. Yes.
What
okay.
it's like. Right. And now add another child to that, and another child. And now you have 3 kids that you have to keep alive every day. Your mind never gets a break from thinking about your children and keeping them alive. And what do I have to make for dinner? What do I have to pack for lunch? What are they going to eat for breakfast? Do I have enough food? Do I have enough diapers? Do I have enough underwear? I just had to order $200 worth of uniform clothing this morning.
Yep.
As I was filling something else out. And my kids, you would think that they're going to school naked. That's how many pants and shirts I ordered for my kids, because just watching them go out the door in the morning with holes everywhere.
Yeah, I was going to say $200 from those. I went to Catholic school. That's like what, like 2 pairs of pants and one polo, and like maybe they'll throw in embroidering for you.
No. This uniforms these days, or at least in my kids' school, it's Old Navy and Children's Place. The shirts are $10 and the pants are like $12.
Amazing.
Yeah, it's
Well,
cheap.
Flynn and O'Hara was the one that would get you, but we would go to Gap and get like the navy blue polos, and like my mom would just take it, to the local embroiderer to do it. But that's
Nice.
You got it, girlfriend.
Yeah, no, but literally I had to order like 4 shirts and 4 pants for each kid because even though school just started. So these are things that are constantly going through my head. You think this is what my husband's thinking about? You think my husband, as he's going out the door in the morning, is thinking about, is there enough snacks for their lunch? What am I making for dinner?
Kacie and I are vigorously shaking our heads no.
Right. No freaking way. No freaking way. Yeah. So
I feel like, the image of Alan from The Hangover where he's like card counting and there's just like the numbers in front of him and everything's just going, like that's what you're doing, but then like you're also like making dinner.
Yeah, that's moms
like
at every minute of the day.
Yeah.
So with that, I want to transition into the next question about some neuro issues being Alzheimer's and dementia. And what we've heard is you got to keep your brain active. You got to do mind games. You got to do this, that, play card games. Keep your mind active. Is being a mom and the things that we do, is that enough to ward off Alzheimer's?
1,000%. 1,000%. And that could be why there's a higher risk for men getting Alzheimer's than female, because our minds are constantly active. But definitely having all of that in your mind and pulling it up at every second of every day. Absolutely. That is definitely keeping your mind active.
Okay, wait. So I'm coming up with a great hack now based on what you just said. You can tell your husbands, honey, I really care about you and I don't want you to get Alzheimer's or dementia. So I feel like you need to take these 17 things off of my list and you need to do them.
But it takes,
to keep your mind.
But how long is it going to take you to write down those 17 things? And that's the problem. So going back to Alzheimer's, because Dr. Stoll, Sharon and I have talked about this. There are big breakthroughs now for Alzheimer's, something that really not catapulted it. I mean, Alzheimer's I think almost everyone, it's like cancer. Like, somebody that's been touched by someone dealing with cancer or Alzheimer's, but you see Chris Hemsworth. So he found out through all this testing that there is now that he's predisposed. I have the same thing. I have a slightly increased risk according to 23andMe, which I'm not going to get into that whole debacle. But what do you do besides what can you do, or what medical things can you do?
So right before you said what medical things can you do, I was going to say it sounds easy, but it's actually extremely, extremely difficult. And this is from a holistic approach and also from a medical approach. Honestly, I swear to God, it's eating better and exercising, and that's it. And of course, we can never be perfect, nor should we be perfect, because then you're going to make yourself crazy with anytime you have something that's not healthy. But in general, anything that's good for the cardiovascular system. So cardiovascular health, we're talking Mediterranean diet, lots of green leafy vegetables, avoiding carcinogens like hamburgers, hot dogs, red meats, McDonald's, fast foods, anything like that, or reducing it. Plays
it really that bad?
Role. It is. It really is. And I say that as I'm thinking about what I'm going to feed my kids today for their third dinner, and it'll probably be hamburgers. So, but honestly, for people that are predisposed, it's more important as we get older, but honestly, even our age range where it's not a risk now, but this is where starting to make those changes can really impact somebody later on. And then again, now we're trying to remember 15,000 things in our minds for our kids to do. And not just now, but I just remembered I also have to sign my kid up for summer camp this summer because it's going to get full again. See, all the things
summer just ended. It's crazy.
Yeah, no, you don't sign your kids up for some of these camps. That's it. They're full. They're full. By Thanksgiving, they're full.
Where do your kids go?
it's insane. Um, so God, every year somewhere else because my older one didn't like the camp last summer. Um, yeah, and my little one is really attached, and I want him to go to sleepover camp
Are
this
they at
summer. But
sleepaway camp?
my older one, yes. My younger one, not yet.
Okay. I was a Camp
Yeah.
Quebecer.
Okay. Nice. I love sleepover camp.
Yeah.
I was only allowed to go to tennis camp. I was never allowed to go to sleepover camp. And that was like 2 hours in the morning for a week.
Okay,
That
well,
was my
so
camp.
speaking about camp, lots of activities that kids do there. Does that freak you out at all as a mom, as a neurologist, as somebody that knows how sensitive and obviously vital the brain is? Are there activities that you get worried about your children doing or competing in, or that like constant
Like ever. Yeah. Like, is there a list of like, I will not let my child do XYZ?
So I come from a different perspective because my husband and I are very not athletic, and our kids, God bless them,
Same.
are also very
Same.
not athletic. So even if they played things like football or baseball, they're not getting past even high school level. Like, yeah.
Well, what about like for your patients, like for your patients who have like crazy athletic kids or any kids? Like I've heard people
Yeah.
say, I would not let my child ride an electric scooter. Or like my
Okay.
teen, or like kids go to college and like they're drunk and they're like, oh, I'll just scooter home, and it's like, then you hit a curb.
So funny. This summer, and I was actually in Europe last week, everybody's scootering everywhere. And the whole time I was like, where are all the helmets? There's no helmets to be found. And I was actually in Israel for 3 weeks this summer, and I was scootering the whole time with my kid. We were both wearing helmets. But yeah, I was taking, in certain situations, it's inevitable that they're going to ride on electric scooters. Honestly, I think the amount of video games kids play these days is more dangerous than them being on a scooter or a bike um, or playing minor league, fill in the blank, football, baseball, something. And I know Kacie, with your husband being who he is, I'm sure your kids are going to be athletically gifted.
But why do you say that about video games?
Video games? Oh, screen time is horrific. And it's basically like crack cocaine for kids. It literally is. It's that addicting for kids. Screen time. Video games.
Age out of that, or is that like a lifelong thing?
It's a lifelong thing. It's something that, especially, I know, Kacie, we were talking about this a little bit last week. Teenagers or preteens now coming onto social media, it's so unhealthy, and it really just so this is what I mean, that it's like cocaine.
What does it do to the brain? Yeah, like what does it actually?
So it feeds
what does it
into
do?
this reward loop that every time they get a like, there's a dopaminergic surge in their brain, and then another like and another like, and it's basically trying to do something to get another like, and it's like we say, or we used to say, that longer programs are better for kids rather than having shorter programs. Like if something's 5 minutes and then switches to something else, that it encourages inattention. And even a few years ago, we were looking at things that were 5 minutes in length being too short. And now on TikTok and YouTube, these short videos
like
are
seconds.
30
Bam,
seconds,
bam, bam.
30 seconds. So every 30 seconds, basically, they're getting another hit of dopamine.
Mm-hmm.
And it's just the swiping and the swiping and the clicking and the liking and then the constant feedback loop. It should never be that fast. So when we were younger and this stuff wasn't as rampant, for you to do something and have a positive reward or this dopaminergic surge, it could have been a day, it could have been a week. You know, you give your kid an allowance, they get money every day, and then at the end of the week, they could buy something. Now, if that kid doesn't get that hit every hour, let alone every day, they're craving it. And it's like, I need, I want, and that's why it's so dangerous.
There's
And
obviously
again,
the problem here
every
with the fact that every other kid is going to have social media. So there's no matter what you do as a
Yeah.
parent, there's going to be the influence from their friends and from the community and family of other kids that are coming in with social media. You know, I myself am thinking now, my oldest child is almost 3,
yeah.
and I'm like, she's never having social media, but I'm going to be realistic about it.
Well, listen
I
to
know,
what Sharon did.
I know I have to implement it at some point. Like, what in your eyes is an appropriate age to start to fold it into their life?
So it's funny. I have this conversation with my older son, who's very, very, very intellectual and mature, like way beyond his years. In addition to being a trash can, you know, for food and whatever else I said before. But
A mature virus.
right,
A standalone virus.
um, um, he always anytime I tell him no about something, he comes back at me and says, yeah, but my friend is doing it, my friend has this, like he wanted a virtual reality headset, and I said no, but so and so has it. So, and I would always say, you know, American Academy of Pediatrics says until you're 14
They
you
must
can't have,
absolutely hate that you're a doctor.
literally I quote
Oh my
him. I
God.
quote him, American Academy of Pediatrics. Like my 9-year-old is like, why can't I have more
And
screen
you're
time?
like,
And I'm like,
and not to
because
mention, they're like $500 a pop for these stupid glasses, goggles,
yeah,
whatever they
yeah.
are.
I'm like, American Academy of Pediatrics is not until you're 14. Your brain's not developed and your head's not big enough, and you know your eyes are going to become cross-eyed. And then he'll come back and say, yeah, but why can't I do this and this and this or whatever? And I said, listen, even if you're fully developed at 12, so he has a kid in his class who's 12 who's 5'8". I'm like, just because that kid's 5'8", can he get his driver's license? No, because the frontal lobe in your brain is not developed, and until that frontal lobe is developed, you will make forever poor decisions, very poor decisions. And that's, he gets that. He's like, oh, okay, fine, so it's not an age thing, it's a poor decision thing. And then he'll throw at me like, yeah, but I made this good decision and that good decision. And then I like pray, like, just make a poor decision so I can throw in that example. Like,
Oh my
girls
God.
just
How
you didn't
old
look
is it different for boys and girls when they're developed?
It's much, much harder for girls and for parents of girls because hormones kick in earlier. They hit puberty younger, and but still their frontal cortex is not developed. Their prefrontal cortex is still tiny.
Sharon and I were gabbing for like an hour last week. So there are two things that you just brought up that I want you to talk about. Talk about the contract that you guys drew up. And then also I want you to talk about why these girls are hitting puberty so early.
Sure. So the contract is all of my kids' friends' moms and I all agree that our kids should not be on social media, and we want to delay them getting a cell phone as long as possible. So we basically all agreed that our kids are not going to be on social media, and that way no one's pressuring anybody from doing this. And that's for my older son's class, and we started that years ago. And now this year, even for my younger son's class, so he's in 3rd grade, another mom actually sent out a contract basically that we agree, if we choose to, we agree to not introduce social media to our kids. And of course, all the moms are thrilled to sign it. We all show our kids, like, by the way, we're signing this contract, so no social media for you. And it's something that even my 7th grade boy now, again, no one in his class is on Instagram or TikTok or Facebook, and very few of them have phones.
Is there 100% participation throughout all the
100%
moms, all the parents? Wow,
yep, 100%
great.
participation.
Are the girls in on it too, or it's just the boys?
It's just the boys. Yeah.
Why is that? Why was the choice to just the boys? Why did you reach out to the female moms, or like, what happened there?
So in his school, they're at this age, they're separated,
Okay.
the boys and girls, and also because of the girls. So again, we all know that girls are more mature than boys. Um, Parents of girls allow their girls to go to their friend's house by themselves and have more independence. So they wanted their kids to have phones just so their parents could call them and say, "Hey, did you get there okay?" But I think a lot of them are not on social media, and there are now, even if you get a smartphone for your kid, you can block certain
Mm-hmm.
apps. So I think a lot of apps are blocked, and but I'm not as familiar with it because my kid doesn't even have a phone, and
Which is great.
yeah,
Yeah.
but no pressure to join anything or watch anything
What are
other than
the penalties if you breach the contract? If you're the weak mom in the class?
no, honestly, I mean, kids these days, it's really all about peer pressure and social pressure. So if most of the kids in your class are not doing something and you're the one doing it, then you're the odd man out. Then you're the one that it's
Mhm.
like,
Yeah.
all the kids are like, "Oh, I can't believe you have that. That's, I don't even want to hear it. I don't even want to talk to you about it."
Do
And if
you,
you make
as a
it as
collective,
like,
do you have an age in which you're saying, okay, we're going to allow them to do it, or you just haven't you haven't got to that point
"Oh
yet?
my God, honestly, I'm just from like a brain development standpoint, I'm thinking he's got to be at least 16 to even know how to
35.
handle anything." Yeah, it's just,
He's
I,
married with 2 kids, and Sharon's like, "All right,
Happy
I
40th
think it's."
birthday, son. Here's your
now you
first
can have
cell
the
phone.
phone. Oh my
Oh
gosh.
my
I
god.
honestly, I'd rather my kid be like this is terrible.
The
This is
dork, like, the
certain things.
dork. Be the dork.
Yes, yes, exactly. I'd rather my kid be a loser now and cool later on than the other way. I don't need my kid
Don't
peaking in high
don't
school.
peak in 7th grade, baby. We
I
got you.
know.
Exactly.
Oh man.
Exactly.
How about it? What about for ourselves? I mean, it's so easy for, we can say all that what we want about restricting our kids, but then we're sitting over there scrolling, in over the kitchen. What should we be restricting ourselves to with
Yeah.
social media?
No, honestly, now my little kid restricts me because when I put him to sleep at night, he's like, "Mommy, remember we have a rule, no cell phones at bed." And I'm like, "Okay, you're right, you're right." So he keeps me, from scrolling at night as I'm putting him to sleep, which is great. I need that because clearly I'm
Yeah.
attached to my phone.
I've been
But
trying. I forget if I've spoken about this on the podcast before, but I've been trying to implement from like 5 to 7, no phone zone, like leaving it in
yeah,
the other room. I don't want to be on it around my kids. I don't want them to see me on something and be like, "Oh, I want to watch that too." And why is it okay
Yeah.
for me to watch and not them? And just
yeah,
the like how easy it is to suck you into it. And like, I'll
yeah,
go on, my husband and I'll be talking about something and I'm like, "Oh, that's right. I have to order flowers for this party we're going to on Saturday."
Mhm.
And I go on for one simple task. And then, 30 minutes later, I did 7 other things. And
Right.
I
yeah,
miss that time with my kids. So
yeah.
I'm trying
No, but
to
honestly,
set,
Oh, Jack's
I
1 and
heard
picks up my
somebody
phone and
say this.
knows, like,
yeah.
What were you saying, Casey?
no, I just said Jack knows. He's 1. He picks up my
Yeah,
phone and he's like, "Bell, like, call my sister," is what he's saying.
yeah.
Hmm.
Like, he's 1.
Yeah, no, but the one thing that I heard in the past that sticks with me now, which is for me, you want me to do anything, just target my mom guilt, and that's what I apologize in advance for saying this, but it worked. You don't want your kid to think that your phone is more important than they are.
Hmm.
And the second they see that they see that you're paying more attention to your phone than you are to them, it's game over. And
Hmm.
then also I think part of it'll promote bad behavior because then they're going to do things to get attention from you so that you're not getting it from your phone.
Oh, okay.
So especially with little ones, like if crazy behavior is coming out of nowhere, I mean, because with boys you never know, and they do things that you would have never thought possible. um, a lot of it is trying to get your attention. That's all they want. They want your attention, and
Hmm.
if they see that your attention is somewhere else, they're going to do what they can to get it. But also, more importantly, you want to make sure that they feel they're the most important thing.
Yeah. I agree with you. I mean, that's when I find my daughter is like her whiniest if we're like trying to get something done on the phone and she's just not having it. So, yeah, I agree with that.
Yeah.
Well, she did have to get a new roommate 9 months ago. She didn't
did.
sign up for that one.
She did. She's still working on accepting it, but
she's like a cat. It takes cats like a year to get used to another cat. So
yeah,
it's my little kitty cat.
Oh
Sienna.
my gosh, we had the funniest picture yesterday. We had friends over, and there were like 6 other kids, literally in a circle.
It was so cute
around my son's bouncy seat, and they just loved him. And Sienna was just over on the couch eating chips. I was just like, I don't know what I don't know what they see in him. This is crazy. Yeah.
Well, at least you didn't try and do something crazy to then get attention for herself.
No, yeah.
She had the chips. She didn't care. She's like, all right, have at it. One question that I'm sure you get so much is how important is sleep? Because I can function on 6 hours. I can function on 5 hours if I need to. And that's not good. And I know there's so many different studies with, women don't actually need 6 or they actually need 7. But how important is it and what are the repercussions of it decades from now?
Oh, that's a tough one. I would say so the easiest thing to say is we all need between 7 and 8 hours of sleep. But it's not as important to have the 7 to 8 hours of sleep. What's more important is to get good sleep. So if you're woken up every 5 minutes, it's basically hitting all of the sleep cycles. So hitting 1, 2, 3, 4 REM sleep, 1, 2, 3, 4 REM sleep. So if you're being woken up, which moms get woken up all the time, then you're really not getting that restorative sleep. And unfortunately, I have no way around it because from the time your child is born until, I don't know, they move out of your house, you're going to be woken up by a kid or a noise. I still have no answers to that. If you guys do, please let me know. Yeah, so it's really that restorative sleep that matters. Unfortunately.
No, that's okay. We went over okay. I also
so
I've also been
the hormones for girls.
Yes.
My theory.
Yeah, for girls.
Yeah. So one of the things that I've noticed just in the population, so again, as a scientist, my population is basically my son's friends, but also just in general, I think as women, we can all kind of see that kids, especially girls, are hitting puberty earlier now than they were a decade ago, and really even 2 decades ago. And I think one of the reasons for that is just hormones that are in certain processed foods. And for some reason, it seems to be affecting girls more than boys. And I'm not sure what that's going to mean for the future generations, but something that I remember learning back in medical school was just that risk of breast cancer increases for those that do menstruate earlier. I guess because their bodies have a longer, just a higher production of certain hormones. But again, I'm a neuroimmunologist, not a oncologist or a pediatrician or a hormone specialist. So take that with, a grain of estrogen. But that's something that that I've been noticing just in the population. It seems to be hitting sooner, harder.
I meant to send this to you. I did tell Gianna about this, but I saw that a lot of fast food restaurants were being randomly tested. And I'm paraphrasing here, but a lot of the chicken came back positive for hormones and in particular contraceptives. So they're not wanting these chickens to lay eggs if they're meat chickens. So going back to that theory, it's like, okay, well, birth control tricks your body into thinking you're pregnant, correct?
Yeah.
So if you're ingesting this birth control, not directly, but indirectly, wouldn't that, like, to your point, that could be the cause of it, is what they're putting, like you said, into the food.
Yeah. Just this, and we don't know this feedback loop of what's happening with the hormones that are going in, what it's doing to kids, and even adults, like if that increases risk of cancer later on.
Mm-hmm.
But there is definitely a higher incidence of breast cancer in
And
the
is that
in the
as simple as
population.
like making sure you buy food that says no hormones or no additives or grass fed, or there's so many buzzwords now that you're like, oh my
Right.
gosh, organic
Yeah.
isn't
No,
really organic. It's like,
there are, and honestly, I don't have the answer to that. I really have no idea.
mm-hmm.
There's so much that happens. I like to say I have faith in the FDA and the CDC and these government regulations, but I think they could only look out for what they know about, and I think a lot of things are happening on the other end to get around certain regulations.
Yeah.
It's kind of like what's happening in the in with sports, that there's always going to be a hormone that somebody could take that's not detectable. There's always going to be another drug that comes out that we don't know about until 5-10 years later, that can
Years
change
later.
somebody's
Mm-hmm.
metabolism. You know,
Ugh.
yeah, it's scary. It's really scary, but you know,
This is why we as moms can't rest. There's
yeah,
always something to
exactly.
think about.
Right. We're always thinking about
Oh my
it. Right.
God. Well, that's good though in the long run. It'll keep us mentally sharp.
Right.
Sharon,
That's
you're
what we
the
learned.
best.
Yes.
Thank you so much.
Sure. Thanks for having me.